For years, we've been hearing about the health benefits of eating certain types of foods or superfoods such as the blueberry. Besides being yummy, as my toddler would describe it, blueberries are rich in vitamins and antioxidants. And while the vitamins in blueberries have been shown to promote and maintain healthful living, the antioxidant found in it called pterostilbene can significantly prevent cancer, diabetes, and cardiovascular disease caused by chronic inflammation and oxidative stress. So with that, I'm here to tell you more about this powerful little molecule and how Therapeutic Solutions International has maximized its potential and delivery system. This phytonutrient is found mostly in blueberries, but also in the skin of red grapes, vines, and almonds. In plants, it's a phytoalexin that protects against parasites, fungus, insects, and sunlight. In other words, a plant's immune system. In humans, it's a powerful antioxidant and anti-inflammatory. Another antioxidant found in blueberries and made popular by red wine is resveratrol, a weaker cousin to pterostilbene. However, its chemical makeup causes it to be eliminated more rapidly from the body and is not as potent as pterostilbene. The research surrounding this molecule has been around since 2004. Scientists have been studying its effects against a variety of health issues, including cancer. Cancer is a disease of inflammation. Without inflammation, cancer dies. Here is a picture of cancer cells before and after its treatment with pterostilbene. Pterostilbene stops cancer from multiplying and spreading, causing cell death or apoptosis. So does this work in humans? Here is an animal model of a human head neck cancer being grown in a mouse. As you can see, the more pterostilbene given, the smaller the tumor becomes. Here is another example showing how pterostilbene decreases tumor growth, this time in breast cancer. Seen here are two sets of mice. The first set is on a normal diet. The second set is on a normal diet and pterostilbene. Within 7 weeks, the tumors where mice were given pterostilbene become smaller. So how much pterostilbene is needed to see an immune response? Obviously, consuming blueberries isn't enough. For cancer patients, the desired dose is 300 milligrams per day. Although pterostilbene can significantly prevent cancer, its solubility and stability is limited in its powdered form. Here to tell us more is the CEO of Therapeutic Solutions International, Tim Dixon. Tim, tell us more. So Tim, what's the difference between your pterostilbene and the one I can buy at CVS?
Oh, that's a really good question. So at CVS, you would buy a capsule form of pterostilbene, typically 50 milligrams, 100 milligrams in the capsule. Take 1 to 2 of those a day. It's pretty typical.
Okay.
Our product is not a capsule product. It's a liquid product.
Okay, so you're saying it's better absorbed?
It is, yes,
Okay.
because it's liquid, because, well, it's actually a nanoparticle. So the powder pterostilbene that you're going to take is a microparticle. So the individual little pieces of pterostilbene are large, and they have to be digested and metabolized up into your blood system. We make a liquid form that is nanoparticle in size, so it's much smaller and it's easy to absorb.
Okay, so what is a nanoparticle?
Oh, so nanoparticles on scales of things. We have nanoparticles, microparticles, macroparticles. It depends on how big they are. So as an example, a red blood cell is about 7,500 nanometers in length, but is completely visible in light. So you could see red blood cells. You know, if you cut yourself, you'd see the blood, wouldn't you? So you can even see it with your naked eye. Nanoparticles can be both visible and non-visible. The particles that we're creating are in the non-visible light spectrum, so they're down around 75 nanometers. So that means you could fit 100 of them across the face of a single red blood cell. That's how small they are, to put it in comparison. Or better yet, think of a period at the end of your sentence, an 11-point font or whatever it is. 10,000 of these particles will fit across the face of that period. That's how small they are.
So a very potent product you have.
Very potent. So nobody had ever consumed a nanoparticle form of pterostilbene before, and so we really didn't know what kind of bioavailability we were going to see with it. So last summer, the company conducted a pharmacokinetic clinical trial where we took 10 healthy volunteers. 5 of them consumed powder pterostilbene in capsule form, 300 milligrams, and 5 consumed 300 milligrams of our nanoparticle formulation. And we measured the amount that was in their blood over time. So at the 4th hour, when both the powder and the nanoparticles peaked in blood serum, the nanostilbene showed 55% more compound in blood than the powder did. So just on that alone, the simple answer is, why would you take powder when you can get twice as much in your bloodstream as compared to the powder?
Right.
And then more importantly is what we call the half-life. How long does it remain in the system until it is no longer available? The pterostilbene powder ran out at about the 14th, 15th hour. The nanostilbene continued into the 26th hour.
Okay.
So not only did we have 55% more in serum concentration, we had double the biological half-life in the molecule.
Wow, so it's effective. What about its safety?
Well, it's effective in this regard. Also last summer, we completed the pharmacokinetic trial. We validated the dose that we saw that we had an immune response at that level. We then took that same dose and tested that same 300 milligram dose in 12 advanced solid tumor cancer patients. So over the course of a 3-week period of time, they consumed 300 milligrams a day of this. You said earlier that cancer is a condition of inflammation, and that if there is no inflammation, there is no cancer. So some of the culprits that are involved in cancer inflammation are in what we call cytokines, and they are inflammatory. Interleukin-6, C-reactive protein, tumor necrosis factor alpha. These are sort of the big heavy hitters in the inflammatory world. So we designed a study to look at those biomarkers. So as we observed these patients across a 3-week period of time, blood was taken and it was assayed against these biomarkers. And what we found out is that the nanostilbene was able to reduce interleukin-6 by 26% on average of the 12 people. But some of those patients had high reductions, 70, 60, very high numbers. The tumor necrosis factor alpha, we were able to reduce that by 28% on average. And in the CRP, we were able to reduce that about 26% as well. So that's really wonderful. That's really great that the nanostilbene could do that. But more significant than that was that we saw an increase in the production of interferon gamma. Why? Because we suppressed those inflammatory cytokines that allowed the pro-inflammatory cytokine, interferon gamma, to begin production again. And the outcome of that was an increase in NK cells, natural killer cells. We saw on average a 37% increase in these NK cells. That's really significant if you're on drugs like Herceptin or rituximab or cetuximab. They need an active NK cell compartment, and so this is what our results were.
Great.
Now, you asked also about toxicology. At 300 milligrams a day, it's very safe. It's completely non-toxic. The toxicology studies that exist in the medical literature there aren't any toxic responses until you get above 17,000 milligrams a day. We're down at 300 milligrams, so it's very safe at that level.
Wonderful. Where can I buy your products?
You can buy our product from youcanordernow.com. This is our product here, nanostilbene. This is our new formulation, by the way. It contains peach kernel extract, which is it's been fortified to further reduce that tumor necrosis factor. And so this is our new version of nanostilbene. It's 200 milligrams to the milliliter. A daily dose is 1.5 milliliters. So each drop delivers 10 milligrams of the active ingredient.
Great.